Hey, what's up everyone? Nate with Free Range American with another pro tip. Before we get into today's pro tip, if you already haven't, make sure you like and subscribe. Enable notifications, that way you don't miss out on any of these pro tips. Today's pro tip is going to be, what is the most important medical tool? I've been an Army medic since 2007. I've seen lots of tools and equipment, lots of gimmicky stuff, lots of stuff that's been super life-saving, literally. As a question, as you can contemplate, what do you think the most important medical tool is? I'll give you a hint, it's nothing on this table. If you said an assessment, you were absolutely right. If you didn't say an assessment or you said it out loud, then I don't believe you, and the person next to you probably didn't believe you. I remember the very first time that I heard this, I was like a brand new medic. The physician assistant looked up, it was an 18 Delta, came to us from the Ranger Battalion, looked up to this guy, and one of the most impactful things he ever said to me was, hey, the most important tool you're ever gonna have is your patient assessment. Like the most important thing you should ever know, you should practice all the time, should be a patient assessment. If you don't know what a patient assessment is, the acronym that we've kind of distilled things down to is an acronym called MARCH, M-A-R-C-H. It stands for M is massive hemorrhaging, A is airway, R is respirations, C is circulation, and H is hypothermia, head injury. Some people add HELP onto that, but those categories are what we're going to use to have a systematic approach to actually take care of casualties, patients, whatever you want to call them. The reason why the patient assessment is the most important tool is because you can't treat injuries that you don't find. And if you don't have a way to find them, if you're not looking for something specific, there's a good chance you could move right past them. And especially when things are stressful in the heat of the moment, you might only jump to the things that are jumping out at you, like literally. And if, bleeding, for example, is something that often demands someone's attention, you look at it, you're like, oh my gosh, there's so much blood. And that's what you get stuck on. And bleeding is obviously important. We try not to bleed to death, but I also still care about other things. And so what this is it's a balance of priorities. We've staged each phase of assessment in the order that we have it in, because some things are statistically more likely to kill you faster than others. And what we're specifically trying to intervene for are preventable causes of death. Like, what are the things that could be wrong with you that we actually can do something about? And so that's why we've created the March Assess, because there's a difference between checking for something and looking for nothing, right? When you look for nothing, you're just, okay, is there, everything seems fine over there. But checking for something, that's the difference between, that's like trying to find your kid on the playground, right? You don't stop until you've found what you're looking for or made sure that you've accomplished your task, and you search in a more deliberate way. That's probably a better way of putting it. The other thing is in these situations, obviously someone's getting hurt. There's elements of danger involved that might have to be balanced and prioritized based off what you can even possibly accomplish. I need to have a systematic approach, right? The way that we get good at anything is consistency. And if I can't practice something, if I don't have a pattern or a process, I can't get consistent. And it's impossible to kind of preemptively think about all of the patients and all of the injuries, all of the mechanisms of injuries that can happen to somebody, and to have a perfect plan for each one of those. So instead, what I need is an overlay. I need something specific enough, but also broad enough that I can lay over any single casualty or patient and still be able to manage their care effectively. That's what the March assessment is, right? So we start with massive hemorrhaging. I'm looking for blood that is moving, and I'm looking specifically for compressible hemorrhages that I can use something like a tourniquet or combat gauze or pressure dressings to be able to manage the massive hemorrhaging that's moving. Then we have to move on to airway. The question for airway is it open? If it's not open, well, I need to maintain it. If someone's screaming at you while stressful, that's a good indication that their airway is open, and that's helpful. Moving on now to respirations. Respirations that's their breathing. And obviously an open airway and respirations kind of go hand in hand a lot. That's this self-feeding loop a little bit. It's hard to measure good respirations if there's a closed airway. That's why airway's before respirations. For respirations, I'm looking for the rate, rhythm, and quality of their breathing. That's when I open and expose the chest wall. I'm looking for anything penetrating chest trauma. I'm looking for things that could be impediments to breathing. and to be able to manage that specific care. So then I can move on to circulation. Circulation is basically I'm checking perfusion. I'm making sure that the blood with the oxygen is getting to all the tissue that it needs to get to as distally and far out as possible. And then I want to do things to promote perfusion, to keep the blood and the oxygen circulating. The last is hypothermia, which I'm from Phoenix, Arizona. And if you think that you're safe in Phoenix from hypothermia, when it comes to trauma, you're absolutely not. I still want to do things actively and aggressively to prevent hypothermia. When our life force basically is draining from our body, it creates a chemistry problem in our body that makes us more susceptible to hypothermia, and then it kind of starts this cascade of problems that we don't want. So I'm always trying to keep trauma patients warm and preventing hypothermia actively and aggressively as soon as I can get to that step. What I need to be able to do is to be able to assess. Like, the goal is to find and to treat all injuries. That's the objective. If I'm not paying attention, if I'm not assessing the breathing, if I'm not listening to the airway, am I going to notice subtle changes and differences 10 or 15 minutes down the road that show me that I'm trending in the right direction? That's the purpose of the assessment. It's actually being in tune with what's happening to the casualty and their physiology, and not just, oh, I threw on this bandage and I tightened that tourniquet. But what I really, to get good, to be effective and to be consistent, I need that assessment to really gauge and monitor where somebody's at each of these stages to prevent all the preventable causes of death and measure their change for better or for worse. So again, having this cognitive process, these mental speed bumps of what am I looking for? How do I check? And if I do find something, well then yeah, I need to have the tools that are appropriate to be able to manage it. But I can improvise those if I understand a little bit more of the physiology and why I'm trying to do something. Okay, so hopefully I made my case, or why the patient assessment, the March assessment, is the most important tool that you'll be able to keep and to utilize to be able to treat and manage casualties, to find and treat all wounds, which is the actual name of the game, or the objective.